Hi everybody, it's Amanda Ridout, health coach. Welcome back. We are here with our favorite pharmacist, cosmetic chemist, and nutritionist, Ben Fuchs. How are you, Ben?
I'm doing great. Nice to see you again, Amanda. You look
Nice to
great.
see. Thank you. So do you.
Thank you.
So today, Ben, we're going to talk a little bit about the lymphatic system, and lymph health. And the reason I'm so interested in this is because I recently partnered with a thermography center here in the Dallas area, and it is just
Love thermography.
I do too. It's so interesting, and I had a whole body scan.
Like it's for
No,
whole
this
body.
is a
They
whole
do it instead
body.
of- they do them instead of mammograms. It's way better to get a thermography
Yeah.
scan than a mammogram. You don't have to.
Absolutely. And I had gotten one of those years ago, just the it's a more simplistic form of it. This is very, very detailed. It scans even your teeth, and it shows up if you have cavities. And one of the things that showed up in mine is I have some lymph blockage. And I would have never known that. Really, I would have never known that. And these thermography scans can pick up disease 8 to 10 years before it actually forms. So I wanted to talk about lymph health. I don't know, nutritional
Yeah.
protocols, drainage. Tell us a little bit about
The
this.
lymph is very, very underappreciated and unacknowledged as a source of disease and a source of bodily breakdown. The lymph is like a vessel, a fluid and vessel system. Like your blood is a fluid and vessel system. The blood circulates through the body and the fluid we call the blood circulates through the body in vessels. The fluid called lymph fluid circulates in the lymphatic vessels in much the same way. It's kind of a parallel system to the blood. And actually they interact. The lymphatic system and the circulatory system, blood circulatory system interact with each other. The one difference is, or the major difference is, I should say, the lymph doesn't have a pump like the blood has a pump. The heart pumps the blood, right? The lymph doesn't have such a pump.
Right.
So while the lymph is circulating just like the blood is circulating, the lymph has to do it without pumping action. That's a pretty difficult trick, a pretty difficult feat. That creates an issue. If the lymph is not moving, I'll tell you how you move your lymph in a moment, but if the lymph is not moving, it can pool up. That's called lymphatic stagnation, and that can create all kinds of problems. Now, in order to understand why the lymph is so important, we got to understand what the lymph does. Lymph does two main things. Number one, it's part of the immune system. It's part of the defensive system. It helps purify the rest of the body, specifically the blood as well as the tissues. And number two, the lymph is a delivery system for nutrients and for fats. Nutrients and fats travel through the lymphatic system, specifically vitamins D, E, A, and K, your fatty vitamins, as well as fats, dietary fats travel through the lymph. So the two main roles. It's going to and also hormones travel through the lymph. So it transports hormones and nutrients and fats, and it's also part of the immune system in the sense that it's known as your body's sewage system.
Right.
It helps the body clear out toxins. Now, when stagnation in the lymph occurs, that means you're going to, number one, not be able to eliminate toxins. Toxins are going to build up in the body. You can tell this by how you just described the swollen lymph nodes, or you didn't even have swollen lymph nodes. You just heat coming off the lymph nodes, correct? You wouldn't have known. Now, if you got really sick, you would have had swollen lymph nodes. So that could be one of the problems that occurs. You can also have, in addition to accumulation of toxicity, you're going to have a problem transporting your fats and your fatty vitamins. And that can also create issues, malnourishment at the level of the cells. So when the lymph doesn't move, we get sick. That's basically how it works. If the lymph doesn't circulate, we get sick. Toxins build up, nutrients don't get delivered, hormones don't get eliminated, and this is another interesting issue. Your steroid hormones have to be processed and eliminated very quickly, particularly estrogen. If your steroid hormones are not processed and eliminated very quickly, breakdown products of those steroid hormones can be toxic, especially estrogen, and this can lead to a lot of health problems in women, including cancer and autoimmunity. You know, most autoimmune diseases, most thyroid disease, or most patients who have autoimmune diseases, most patients who have thyroid diseases, most patients who have Alzheimer's disease are women. Yeah. Women, and a lot of these are related to a problem clearing out estrogen. And this can be one of the causes of this can be clogged and sluggish lymph, because the lymph is responsible for transporting these estrogen breakdown products, these toxic estrogen breakdown products. long story short, when your lymph is stagnant, when your lymph isn't moving as well as it should, when your lymph has accumulated toxicity because of poor lifestyle issues, poor diet especially, we get sick. We get skin issues, we get boils, we get acne, we can have eczema, swelling, edema, frequent colds, frequent infections, problems healing, fibromyalgia, chronic fatigue, soreness, breast tenderness, brain fog issues, autoimmunity. I mean, the list is almost endless, including cancer and heart disease, the two biggies. The list is pretty much endless of things that can go wrong in the body when the lymph isn't moving as well as it should. The major risk factors for lymphatic disease are digestive issues. That's the biggest problem. By far and away, the biggest risk factor for lymphatic stagnation is digestive health issues, problems processing foods, food allergens, especially problems processing fats. Because remember, the lymph is responsible for the transport of fats. So if we don't process fats, we don't digest our fats correctly, the lymphatic system can become clogged and stagnant. Diabetes, kidney disease are also risk factors for lymphatic problems. Obesity, cardiovascular disease is a risk factor for lymphatic issues, and sedentary lifestyle, sitting around, not exercising. Because remember, the lymph doesn't move. The lymph doesn't have a pump, I should say. We're the pump. The way the body is designed is the lymphatic system is kind of wrapped around with the muscles. And so as the muscles contract with our day-to-day movement, the lymphatic fluid is propulsed upwards towards the heart. Lymph is always going towards the heart. From the bottom of the body goes towards the heart. From the top of the body goes down towards the heart. And by moving our body, we can actually create a pumping action that will force the lymphatic fluid upwards towards the heart or downwards towards the heart, depending on where it is. Okay. So by far and away, the most important thing you could do to help support lymphatic drainage is move your body, exercise. Along with exercise, breathing is very helpful because breathing also has a pumping action on the lymph. As we breathe, we contract the lymph and we propulse the lymphatic fluids towards the heart, upwards towards the heart or downwards towards the heart, depending on where the lymphatic vessels are. So number one, exercising is very, very important. A rebounder is great. Inversion devices can help facilitate the movement of the lymphatic fluid if it's stagnant. You know what else is really good is dry brushing.
Yeah.
Dry brushing is really interesting. First of all, dry brushing is great for your skin. It helps exfoliate dead skin cells and helps stimulate more collagen production. But you have a lot of lymphatic vessels under the skin. And so dry brushing is kind of a way to help stimulate the elimination of lymphatic fluids or lymphatic toxins out through the skin. The skin is known as your third kidney. It's kind of an eliminative organ. Boils and cysts, especially boils and cysts around a lot of people get boils and cysts right in this area right here, right? Or even around the sides of the head or on the back. There's a major concentration of lymph right in the upper part of your chest. And so people will get breakouts in the upper part of their chest and also in the upper part of their back, even down in the lower area of the back. These all need to be considered lymphatic issues, not skin issues. It's very misleading because it looks like it's a skin problem. It is not a skin problem. It is a lymph problem. And what you're seeing is the body trying to eliminate toxins from that stagnant, congested lymph. And it's coming out through the skin. It's not even coming out through the skin. What you're seeing is the pressure upwards as the body tries to eliminate those toxins. So boils, cysts, and that kind of thing, intractable acne, or what I call non-sebaceous acne. Your sebaceous glands are your oil glands, and they're your T-zone, right? You have breakouts along the side here, on the back or the chest. That's non-sebaceous acne. Think lymph. Okay. And you're going to want to do all the things all these remedies, all these lymphatic cleansing strategies, especially exercise, breathing, dry brushing. Saunas can be helpful. Here's a really neat one for helping pump the lymph or move a stagnant and congested lymph. Hot and cold plunges, or hot and cold in the shower. If you're in the shower and you don't want to do it, you don't want to freak yourself out.
I don't like cold.
I know. If you're in a hot shower, you don't really want to turn it on the cold. And get a cold blast. But if you can handle it, it's really good for you. Maybe do cool water if you can't handle super cold water. What happens is when you're in the hot water, the blood is moving in one direction. It's moving out towards the towards your extremities. And when you're in cold water, the blood moves, and the lymph as well, moves internally. So by going hot and cold, you move the blood back and forth, create a kind of accordion-like pumping action. Okay. And because the lymph is tied in with the blood, by moving the blood, you're also going to be moving the lymph. It's actually a great longevity strategy, and they do a lot of cultures in Russia and the mountains. They'll do hot cold plunges, and it's kind of a longevity strategy for them. And that's the thinking. That's the logic behind that. Okay. Breathing, we talked about. Let's see, fasting. Oh, the major source of lymphatic congestion, lymphatic toxicity is going to be digestion and problems digesting your foods. Milk and dairy in general is a huge lymphatic problem because it contains processed fats, pasteurized fats, and damaged fats, and because the lymph is so sensitive to fats, and it's a fat transport system. Dairy is especially problematic.
But what about raw dairy, raw milk?
Well, obviously it's better. It's clearly better, and there's wonderful nutrients in raw milk. If you can stay away from it, it's probably not a great food. But there's good things in there. Sometimes in the world of nutrition, there's good things and bad things in the same food. So you got to kind of make a judgment call on that. It won't hurt you to stay off of milk. If you do a little milk, raw milk, you'll get there's good protein value and there's good nutritional value in it. Raw milk is the best way to go. Pasteurized milk, which is the way most of us do it, big lymphatic problem. In fact, probably the most problematic of all the lymphatic digestion food, lymphatic destroying foods. So, but also anything that you have a problem with, any kind of food intolerances, and especially if you have things like leaky gut syndrome or ulcerative colitis or IBS, things can sort of leak into the bloodstream. Toxins can leak into the bloodstream, ultimately get into the lymph, and that can cause lymphatic congestion. So anything you could do to work on your digestive system, and especially fasting, even calorie restrictions, certainly eliminating problem foods. Talk about some supplements that you could use here that will facilitate that here in a minute. Exercise we talked about. Inversion. Did I say anything about inversion?
You did, yeah.
Hang upside down. Apple cider vinegar can be a good lymphatic supplement. Apple cider vinegar contains water-soluble fats, very interestingly. The active ingredient in apple cider vinegar is something called acetic acid, which is a type of fat that has a chemical structure that lends itself to water solubility. Because the lymph is transporting fats, by using apple cider vinegar, you can facilitate the movement of fats through the lymph, kind of like a sort of a fat thinning strategy. Apple cider vinegar acts as a fat thinning strategy for the lymph. And then there's nutritional supplements. We talked about the digestive system, and anything you do to support the digestive system is going to help you with your lymph. In fact, that is the #1 way to deal with lymphatic congestion, and that's why I love the Swear Will Be Cleanse. We talked about fasting. For people who don't want to fast, do a Swear Will Be Cleanse. I mean, fasting's great. I like fasting, but sometimes people can't fast. A Swear Will Be Cleanse can be very helpful. Of course, the nightly essence is also important. Probiotics help process fats. Anything you can do to help process fats is going to support lymphatic health. So nightly essence and the ultimate enzymes, for that matter. Also,
how about the I-26?
I was about to say the I-26.
I love that.
I love the I-26. It's a great new product. Actually, it's not even that new. It's an immune system building product. And again, anything that you do that supports the immune system, like anything that you do that supports fat digestion, is going to support lymphatic health. Talk about hydration. Hydration is also very important for the lymph, drinking a lot of water. But if you're drinking a lot of water, you want to make sure you're drinking BTT, because as you drink more water, you lose your water-soluble nutrients. I believe this is a hidden cause. Like the lymphatic system is an unacknowledged system behind much of our diseases. I believe that loss of nutrients through urination that aren't replaced is also a hidden cause of illness. And this is why the Beyond Tangy Tangerine is such a wonderful product, because it helps replace those electrolytes and B vitamins and vitamin C that are water soluble that we urinate out, especially if we're drinking a lot of water. And most people these days are walking around with water bottles, which is a great thing to drink a lot of water, especially for your lymph. But it's critical that you replace your electrolytes, you replace your B vitamins, and you replace your vitamin C on a regular basis. There you go.
All day long, BTT.
With your Beyond Tangy Tangerine. And then also the glucogel caps. Okay. And this is another neat thing about the glucogel caps. We always talk about the glucogel caps for arthritis, right? I know we've done videos on this before. The glucogel caps are multifunctional because the glucogel caps help you build connective tissue, right? Yeah. Connective tissue we all think about when we think about arthritis and our joints, but connective tissue is everywhere. 30% of your body is connective tissue, maybe even more than 30% of your body is connective tissue. So when you build connective tissue, not only do you support your joint health, you support the connective tissue in your skin, meaning less wrinkles. You support the connective tissue in your heart, meaning less cardiovascular health issues. You support the connective tissue in your blood vessels, meaning stronger, healthier blood vessels. And by the way, cholesterol buildup and fat buildup around the heart can be also associated with lymphatic congestion because the lymph is supposed to be draining the cholesterol and the toxins away from the heart. So,
wow.
Yeah, so there's a lot of things about the lymph that we don't even think about. Anyway, back to the connective tissue issue. You're building strong connective tissue vessels in the blood, connective tissue in the blood vessels, and that means less cholesterol deposition because one of the reasons cholesterol deposits in the blood vessels is because the blood vessels are breaking down. So all the stuff about cholesterol causing heart disease is really not the cholesterol that's causing the heart disease. It's the damaged blood vessels that the cholesterol is sticking to as a repair mechanism. So using the glucogel caps can help you have strong blood vessels. So it can be important for helping reduce cholesterol deposition. And your lymph is also composed of collagen and connective tissue. So by using the glucogel caps, you can strengthen the lymph and make it more resilient. So the glucogel caps, multifunctional, but also very important for the lymph.
Okay. Oh, wow. Okay. Well, that's a lot of information. So I've been working on a lot of these issues, a lot of these things. I've supplemented heavier on the things we've talked about. I've been rebounding, going to the gym again.
But, one more thing I forgot to say. DEEK, vitamins D, E, A, and K, fatty vitamins are transported through the lymph. If you have lymphatic congestion, you may not be delivering your DEEK effectively, your vitamins D, E, A, and K to the cells. So you might want to consider getting on a multivitamin supplement or the Ultimate Daily or something that's got all four of your fat-soluble vitamins D, E, A, and K.
I've noticed that when every 2 years I'll get blood tests, my D levels are low, and it's probably because of this, because I'm in the sun all day long. I eat great fats.
Absolutely. It could be that. It could also have to do with your kidneys, which also is associated with the lymph. Essential fatty acids, by the way, are another supplement that may be helpful for the lymph. Essential fats are very important for the fluidization of fats. And if you have too much sticky fat inside the lymph, that can cause stagnation. EFAs have a fluidization effect, a liquefying effect, like apple cider vinegar, on the sticky fats that can cause lymphatic congestion.
Well, it's really good to know that there are good, healthy, non-toxic, safe protocols that we can use for the health of our lymph.
None of this requires a doctor. Isn't this cool?
No, that is really cool.
There's nothing in the medical model. There's nothing in the pharmacopoeia, in the United States pharmacopoeia. There's no surgical strategies that can improve lymph. It is the quintessential, classical example of the relationship between our personal lifestyle choices and our health. Is the lymphatic system, because there's nothing in the medical model that can address this, but there's all kinds of things that we can do from the comfort of our own homes and living rooms and gyms that we can do to help improve lymphatic health.
Well, what's really neat is I didn't even need a doctor to figure out that my lymph system was stagnant. So, that's really neat.
You can pretty much assume that all of us have some degree of stagnation going on. And by the way, one of the major organs of the lymph is composed of certain organs. The spleen, the thymus is part of the lymph. The lymphatic vessels are an organ in and of themselves. But one of the most important organs of the lymph are the lymphatics. There's a circle of lymphatic tissue right around your throat that's supposed to trap things that you eat that are toxic. The tonsils are the lymph. And when you have a tonsillectomy, you have to have a tonsillectomy. It's a classic sign that your lymph is big time congested. In fact, it's so congested it can stop your breathing. That's why people will have their tonsils removed. And if a kid has his tonsils removed or needs to have his tonsils removed, that's a classic sign that the kid is eating the wrong kinds of food, because kids usually aren't doing drugs and doing all they tend to be active, and so they're usually not suffering from the other causes of lymphatic congestion. The main cause of lymphatic congestion, the digestive system, is usually at fault or responsible for kids who need tonsillectomies.
Wow. Okay. Well, that was a piece of information that I had never even associated with the lymphatic system. So that's amazing. And there's a lot of kids out there that suffer from these overgrown tonsils and then have them removed. And that's not the answer. So
they still have the same problem. They haven't done anything. In fact,
exactly.
now they have less of an immune system. They have less of a lymphatic system. They've compromised their defensive system by having their tonsils removed. When you think about it, it's kind of ridiculous. Although, if you don't know, you can't breathe if the tonsils get so enlarged. So if you don't know what you're doing, if you don't know about this relationship, then it's understandable. But once you know about this relationship, get the kid off of dairy, correct any food imbalances or any food intolerances, make sure they're digesting correctly, lay off of sugar. Sugar is another big problem. Sugar causes a chemical reaction called glycation, which damages proteins and can damage fats as well. And those damaged proteins and fats have to get eliminated from the body through the elimination system, which is the lymph. So if you're diabetic, you're at higher risk for lymphatic issues. Even if you're not diagnosed as a diabetic, just taking care of your sugar issues and using things like the Sweeties and the Beyond Tangy Tangerine and the Ultimate Niacin and the Ultimate Selenium, all of which help with sugar.
Wow. Okay. Well, everybody, there's a lot of work to be done. Like you said, everybody's probably got some kind of stagnation in the lymph system.
Everybody does. That's why Sweat Cleanse is great for everybody.
Well, thanks, Ben. I think this was a great video. Lots of really amazing information. And we will be back next time with some more amazing information. Meanwhile, everybody, we really appreciate you tuning in and watching these videos. We have a lot of viewers out there that leave great comments. Give us a thumbs up, give us a like, leave us a comment. We try to answer whenever we can, and our information is underneath in the description, so you can reach out to us. Thanks, Ben. You have a wonderful rest of the day, and we'll see you next time.
Good to see you. Take care.
Bye.